Puberty is when your child's body begins to develop and change as they transition into adulthood. It's the time in your child's life when they go through the physical changes to reach sexual maturity and are capable of reproduction. The stages of puberty follow a definite path with a progression of physical changes. The emotional changes of puberty may not progress at the same pace as the physical changes. Both the physical and emotional changes of puberty begin and end at different ages for each child. Puberty starts when a part of your child's brain called the hypothalamus begins producing a hormone called gonadotropin releasing hormone, GnRH. The hypothalamus sends GnRH to another part of the brain called the pituitary gland. GnRH stimulates the pituitary gland to release two more hormones, luteinizing hormone, LH, and follicle-stimulating hormone, FSH. These hormones travel to the sex organs, ovaries and testes, triggering them to begin releasing sex hormones, estrogen and testosterone. These messenger hormones cause the telltale signs of puberty to begin. Boys begin puberty sometime between the ages of 9 and 14. Boys hit puberty about 2 years later than girls. However, Black and Hispanic boys tend to enter puberty a bit earlier than white boys. If your son starts showing signs of puberty before age 9, it's worth asking his pediatrician about these early changes. Similarly, if no signs of puberty have happened by age 15, it's worth asking his pediatrician about this delay. A tool called the Tanner stages outlines the stages of puberty for boys and when they're likely to occur. There are separate Tanner stages for penis, testicles and pubic hair. For parents, the Tanner stages can serve as an excellent guide to the changes you can expect to see in your son. There are 5 stages of puberty for boys. Stage 1 is prepubertal. In this stage, boys haven't experienced any visible changes. In stage 2, physical changes begin. Between the ages of 9 and 14, boys typically begin to experience genital development, growth of their testicles and scrotum, growth of sparse hair around their penis and under their arms, an increase in height, typically about 2 to 2.5 inches per year, which could bring growing pains. In stage 3, physical changes speed up between the ages of 10 and 16. Boys experience continued growth of their penis and testicles, as well as possible wet dreams. Wet dreams are ejaculation at night while they sleep, darkening, coarsening pubic hair in the shape of a triangle in their genital area. Continued increase in height, about 2 3/4 to just over 3 inches per year, more sweating, which can lead to body odor, vocal changes, and cracking in the process. Increased muscle mass. Some breast development, or gynecomastia, occurs in about 50% of all teenage boys, but it typically resolves by the end of puberty. It's most common between the ages of 11 and 15. If this becomes an issue physically or socially, you should talk with your child's healthcare provider. In stage 4, puberty hits full stride between the ages of 11 and 16 years. Boys experience growth in penis size and darkening of the skin on their scrotum and testicles. Red ridges on their testicles called rugae will begin to develop. Body hair growth that reaches adult levels. Pubic hair remains in a coarse triangular peak growth spurt that averages nearly 4 inches per year. Development of acne. Continued cracking of the voice. Stage 5 is the final phase. Puberty ends in this stage. Boys finish their growth and physical development. Many may not develop facial hair until this step in the process. Pubic hair may extend out to their thighs, and some boys may have a line of hair up to their belly button. Most boys finish growing by age 17, but some may continue growing through their early 20s. When your son enters puberty, you may or may not see some emotional upheaval. Increased testosterone coupled with social pressures may cause moody behavior, emotional outbursts and family discord. Parents can typically ride out these issues. Listen actively, and ask when your son wants your opinion and when he just wants to be heard. Keep telling him you love him and are there for him. Step in whenever there are issues of safety or morality, setting loving limits in those instances. If serious emotional problems arise, signs of anxiety, depression or extreme mood swings, it's important to have him evaluated by his healthcare provider. This can display itself as him withdrawing, choosing not to do things he used to enjoy, isolation from friends and family, or a drop in grades. Emotional issues could be a sign of a mood disorder or other psychological concerns. Medication and/or therapy may be useful in these instances. Not everyone is on the same timetable. Some boys begin to see changes very early, which is called precocious puberty. Others may not see changes until later, which is often referred to as delayed puberty. Early, precocious puberty. If your son shows signs of puberty before the age of 9, make a call to his healthcare provider. This may signal a pituitary gland problem or neurological issue. Your son's healthcare provider should evaluate him as soon as you suspect a problem. Possible causes for early puberty include the pituitary gland turning on hormones too early, hypothyroidism, an underactive thyroid gland, a tumor on the adrenal gland or elsewhere if the problem is hormonal. An endocrinologist can prescribe puberty blockers to halt puberty until the time is right. Puberty blockers are medications that prevent your child's body from producing the sex hormones that cause the physical changes of puberty. If your son's healthcare provider suspects another problem, your son may be referred for further testing. Delayed puberty. If your son starts puberty after age 14 or isn't progressing through puberty, you'll also want to check with his healthcare provider. Your son may just be a late bloomer, particularly if his father was as well, but hormone or endocrine abnormalities can also delay puberty. If your child's healthcare provider suspects an underlying problem, your son will likely be referred to a specialist for more testing.